everyone. So, my client Ralph is an older male who experienced a stroke 5 years ago. This stroke caused him to have severe Broca's aphasia. So the type of stroke was not reported, so it could have been ischemic or hemorrhagic, it didn't specify. So when Ralph was assessed, he had an aphasia quotient of 28.7. He had intact comprehension, so he could understand fine, but he had impaired repetition abilities. So when participating in the Famous People protocol, he was looking at a picture of the Beatles, the singing group, and asked to identify John Lennon. He was able to point to him. When asked to identify a person who is not a member of the Beatles, like while still looking at the picture of the Beatles, he said no and shook his head. So this demonstrates that he could comprehend. He could understand that, the man whose name was not in the picture. So then after that, he was able to correctly identify all of the other members of the Beatles group. When asked if he could repeat a word, he simply said no and shook his head. Ralph only says a few simple words such as yes and yeah, sometimes repetitively, and he gets kind of frustrated with his word finding difficulties, as evidenced by moving in his chair like this and saying, oh man, oh man. Ralph's pragmatic skills are appropriate. He has adequate eye contact and turn-taking abilities. His topic maintenance and intonation skills were also adequate. His discourse was filled with word-finding difficulties, like I said before, characteristic of hesitations, fillers, and pauses. So like I said with the fillers, he said a lot of yes, yes, and yeah, yeah. In therapy, he's working on acting out with gestures and singing or dancing what he wants to communicate. So whenever talking about the movie True Grit, whenever he saw a picture of it, he said, and quoting, yes, this, yep, yeah, yeah. But as he said all this, he acted out like shooting a gun. And if you haven't seen the movie True Grit before, the action of shooting a gun was appropriate because True Grit is a Western cowboy movie. So Ralph also had a lack of movement of his right arm. It kind of sat just like this the whole time, indicating a hemiparalysis. And this is the sign of damage to the motor areas of the brain typically, which is kind of around the area of damage that you would suspect typical of a Broca's aphasia too. So Ralph's stroke was likely to be causing damage to the inferior posterior frontal lobe, otherwise known as Brodmann area 44 and 45, or otherwise known as Broca's area, which makes sense because he has Broca's aphasia. So this could have happened as a result of infarct to the middle cerebral artery, which supplies the language areas of the brain. So like we said before, the type of stroke, ischemic or hemorrhagic, wasn't indicated, but it's likely that it was the middle cerebral artery there. So in therapy, Ralph has been encouraged to communicate as best he can in any way possible. So this could be by explaining what he's trying to say, but because he has so limited words, he doesn't use this avenue a whole lot. He is more likely to use gestures to vary his intonation, to sing, or to dance. He's specifically been working on giving clues and acting out what he wants to communicate, which, as you can see, whenever he tried to explain the movie True Grit by his, action of shooting a gun. So a strategy that I would recommend to anyone when working with someone with Broca's aphasia or any type of aphasia at all would be to check with the person themselves about what they want you to do when communicating with them to facilitate the best communication possible. So the person may want you to try to guess what they're trying to say, like whenever they're struggling and they just really can't get the word out, they're having really hard time finding the words that they want to say. They may want you to try to guess it, but they may also want you to just sit there patiently and wait for them to try to get it out, or use the strategies that they've been using in therapy to communicate the ideas that they are trying to communicate. So, like I said, his pragmatic skills are appropriate, his comprehension is appropriate, no problems there, but mainly he has issues with expressing what he wants to say with expressive language specifically. And I believe that pretty much wraps it up. Thank you.
Thank you, Hannah. Alrighty, so I have Mr. Barry. So he is a male, older adult. He's also Caucasian. He used to be a corrections officer and also served in the Marine Corps prior to his incident. He experienced a stroke in 2004. His case history did not say specifically what kind of stroke. That is something I intend to dive into. in our initial meeting and get into more of his medical history. So again, that initial stroke was in 2004, and he experienced or underwent testing in 2009, so that was 5 years later, that demonstrated he had an aphasia quotient of 28.2, and he specifically struggled with sequential commands and auditory word recognition. He was later tested in 2014, and he actually did show improvement, so speech therapy helped him throughout this first part of his therapy career. And in 2014, his aphasia score improved from 28.2 to 37.8. His reading and writing was also not tested. I know with aphasia sometimes that doesn't always stick around, but in some clients you can see the reading and literacy skills hang out after the impairment, so that's something that I also plan on testing with him. So to describe Barry, he's kind of interesting. His speech is intact, however, it doesn't necessarily make sense. His speech doesn't have a lot of content to it, so while his articulation and stuff for the most part is pretty much there, he does have struggles with disfluency, a little bit of stuttering, that kind of stuff. However, there is no content to, or message to what he's saying. On the other hand though, he has excellent pragmatic skills in conversation. He'll sit and talk to you, he'll make eye contact with you, he's engaged, his body posture is always leaning forward to his speaker, he takes turns really well, so his social skills are awesome along with pragmatics. And he does possess some true words, some real English words. He doesn't possess a ton, you don't provide him a ton, however they are still there and within his vocabulary, so that's nice to see. He hasn't lost all of his linguistic skills. When he is struggling, the thing that helps him the most kind of get his message across to whoever he's talking to, whether it be another clinician, a family member, anything like that, he will start using hand gestures, kind of like I just did. One example of this is in a video that I watched from his previous clinician. He was describing what happened to him, his stroke experience, and he was getting in the ambulance, and he was saying a word that kind of sounded like ambulance. It was that last half of that word, booleans, is almost what it sounded like. And the clinician had a hard time. She was trying to get him to repeat that and wasn't really sure what that word meant because she was getting lost in his story. And he gestured to a steering wheel, and she was like, "Oh, ambulance, that makes sense." So his hand gestures are very helpful in conversation. A couple other things that he does is he has an initial phoneme substitution. So sometimes he'll use the word walking for talking. He'll substitute that T for a W. And again, that was resolved and kind of the context was figured out because he'd give us clues with his gestures. He would say walking, but then gesture to his mouth and his throat. So we're like, oh, he's talking about talking. And just having that initial phoneme substitution. Along with the substitutions, there's also some jargon and non-words present. So jargon, I'm not going to really intimidate it, but if you think about a child developing language, that's one of the steps. It's strung together speech sounds that sound like they should make sense and sound like they're structurally correct. However, there's no meaning behind them. There's not a lot of content there going on. And then non-words, one of the examples in one of the videos that I watched from him was he was talking and trying to answer the clinician's question, and he said, "When my beg will." So he just kind of threw that word in there. It's not a real English word. I don't know what a beg will is. I've never heard of that before. So he has some non-words in there along with his true words. So he paired that with two words, when and my, are words that are used frequently in English language. We know what those mean, and those were articulated well, but then he throws in those non-words. And then he also tends to stutter every once in a while as well, and we'll throw in uhs and ums and a little bit of groping behavior too with those. And then other aspects of his communication, again, his speech is intact, but again, it just doesn't carry the context that it needs. Again, he has those paraphrasic errors that I talked about earlier, the substitution of the initial phoneme. His disfluencies, he has other escape behaviors along with the uhs and ums. He will blink and also grope a little bit. And then again, with that disfluency, that causes a little bit of dysrhythmic speech. It's not super connected all the time due to those said behaviors that I just listed. The groping, the uhs and the ums kind of break everything up. The jargon doesn't necessarily help with that as well. And then just some blinking and things like that. Back to more of his linguistic skills. Again, his pragmatic skills are fantastic, completely intact. I talked about his eye contact, body posture, turn taking, all that. That's really great and nice to see for sure. He does lack topic maintenance due to all of the non-words and the jargon that kind of get thrown in and mixed in with his speech. That makes it really difficult for him to stay on topic because those words just get thrown in there and then the message again kind of gets thrown out the window. And along with the topic maintenance, that doesn't help that he also has a limited vocab. Again, he does have some true English words, but there's a lot of non-words in there. And then again, he also has some anomic tendencies, so he gropes sometimes, I think, with his stutter, but I also think he's groping because he can't necessarily find the word. And so like I said, it didn't say what kind of stroke he did have in his case history. Again, I intend to find out either from probably from family, since he probably wouldn't be able to answer that for me. There are two types of stroke, the hemorrhagic and the ischemic. I think this one is probably more of an ischemic stroke that occurred in the left posterior temporal portion of the brain, and more specifically the posterior section of the temporal gyrus. This is associated with like the hearing cortex and more importantly Wernicke's area. And Wernicke's, I know we all pretty much know this, but that's where our like planning of meaningful speech, phonological retrieval, semantic processing, language recognition, all that stuff is in there. And that's really our key components to receptive language and how we understand language. And that's what I think is what's going on with Barry, is he's not understanding the input, he's not understanding his own output. So therefore it gets all jumbled up and mixed up. But yeah.
Okay.
Thank you, Jennifer.
Thanks, Harper. So my patient was Chuck. He is a 60-year-old male, and he previously worked a full-time job in the computer industry. It was a position that required him to have his college degree, and so in talking with his family and kind of going through some of those interviews, I learned that he was very heavily communicative in his role, teaching others how to use the technology, following one-step directions, breaking things down into other parts for his team members, for their clients, that kind of thing. So that kind of led us to kind of compare that to where his current level of functioning is sitting at, which I'll get into in a little bit. When we did his initial testing and I looked at what the previous clinician had worked on, his auditory and verbal comprehension was a composite score of a 5 out of 10. And those came from subtests in yes-no questions, in auditory word recognition, and sequential commands. Of those three, his yes-no questions were sitting at a 57 out of 60, which tells us that that might be a really great strength for us to kind of start with and having a little bit of that verbal expression. His auditory word recognition was sitting at a 37 out of 60, which tells us it still is possibly a strength for him, but may need a bit more work and a bit more scaffolding when we kind of get into the actual therapy process. And sequential commands was currently sitting at a 6 out of 80. So when we think about how this would impact his activities of daily living, being able to really comprehend and then carry out those things that he's working with at home would be really difficult for caregivers and for his partner. Looking at some of his strengths despite his impairments, he had really great pragmatic skills. His eye contact was awesome, and during the narrative, he did a really awesome job with being able to stay on topic. When it came to the content of Chuck's speech, there were a lot of times where he would act out a word as opposed to actually using the label for it. For example, instead of saying that someone had fallen down, he would say, whoa, whoa, and more so act it out to get his point across, which is a really great compensatory strategy when we look at teaching the family how to better communicate with Chuck. For the beginning, when we were kind of talking about and reflecting upon what the previous clinician had done, he did a great job with turn taking. And so although the auditory comprehension may not be as intact as it was previously, he was able to determine when socially a response was required from him, which is a really great strength. And he was also able to, just like I said, have those great descriptive abilities if he wasn't able to say, bell down. During the last part when they were working on a naming activity in the previous video, instead of just labeling something as a cactus, he would show recognition in his face. So again, like that's really great social skills there. He would act it out, and so he would like pose like a cactus, and then he like pointed to himself saying like ouch, ouch, ouch. So automatopoeia again was a really great strength for him. Self-awareness during his communication, I would lead to believe is somewhat intact, because he would kind of give a little bit of the story or a response. It would include some like non-English words where he would be like, Zeraphim, and you didn't know what it meant. There wasn't like a clear indicator of what he was trying to say, but there weren't necessarily any articulation errors within that. So his motor speech was still good for that, but the coding of that language ability is disordered. After he would give a response, he would say, am I saying it? And so that kind of leads us to believe that although he may not be able to process actively what he is saying, he is aware that there may be some deficits in communicating his speech. Thinking of word level errors, kind of like I had mentioned, he had substituted say for hear. So when the clinician said, how do you feel like things are going? He would say something and then he would say, I can't really say what you're saying. And so in that, we know he's trying to communicate that he's not able to hear us, but he would substitute say. Sometimes grammatical markers were left off some of his words. So there was an instance when he was talking about how he could sometimes understand what people were saying, and he said, yeah, sometime I can get it, but sometime not. So that little grammatical morpheme was kind of left off of the end there. When we think about the other aspects, so pragmatics again was totally a strength for him. He was very appropriate, facial expressions changed. Another thing that was a great strength for him was intonation. So when he was able to act out what was happening or wasn't able to find a word, he would kind of change the intonation of his voice and be like, and that kind of indicated to me that there was still some pragmatic awareness of, I can't find that, and I'm kind of holding a filler in my place for the conversation. And then kind of thinking about overall, Chuck experienced a stroke in the arterial venous malformation that did rupture. Because of his disordered language comprehension, that would lead us to believe it's in the posterior temporal lobe, or more specifically the superior temporal gyrus. And yeah, that's kind of where we're sitting at right now and what I was able to see.
Thank you.
Yeah. Okay, so I had Gloria. She is an older adult female. She had an aneurysm in 2006, and prior to her incident, she was running a cake baking and decorating business. So just a little bit about her. When you were listening to Gloria, she has very clear speech, and as a listener, you were able to understand her, but her speech doesn't necessarily make a whole lot of sense. So her speech is extremely agrammatic, which means that she speaks in short phrases and low syntax complexity. So for example, Gloria would sometimes delete phonemes during word production, and then also make articulation errors. So she would say wish upon a tar instead of wish upon a star when she was explaining the Cinderella story. She would also said flipper for slipper, like the glass slipper in the Cinderella story. She would produce words and phrases, repetitions, and repeating them often. So she was explaining like during the ballroom dancing, and she would say dancing, dancing, dancing super quickly. And then she also, something that I noticed, demonstrated limited right arm and hand movement. The patient has expressive language difficulties, so the patient was able to stay on task and explain the Cinderella story, but she did not formulate full sentences. The patient must have receptive language intact, because when I asked her to explain different things, like for example, I said, could you talk to me about the Cinderella story? She was able to fully understand what I was asking her to do, but when it came to actually talking about it, her sentences were very small, and like I said, she like repeated lots of words and phrases. I was thinking that possibly the patient could have apraxia because she used a lot of filler words and had some articulation difficulties, like I mentioned before. When she was trying to think of something, she would say, and she would look around a lot of the times before she could actually produce what she was trying to say. So she had all of her organized thoughts up in her brain, she just couldn't verbally get them out. Whenever she is unable, whenever she was unable to think or say a word, she would describe what she was thinking, which I thought was a benefit for her. So for example, she couldn't think of a character's name, so instead she said, looked around, and she said, big tall man, and like pointed to somebody tall, instead of expressing that character's name. She also used a great amount of hand gestures as much as she could, but like I said, with that limited arm movement, she would like move her hand or like go like that with only one of her hands and arms, but she did do a lot of hand gestures to explain things and facial expressions during her speech. So for example, she was trying to talk about Cinderella's dress and how beautiful it was, but she couldn't get those words out. So she looked down at her body and kind of like went like that and was saying, beautiful, beautiful, beautiful. So although you are able to understand this patient, she was able to maintain the topic of the Cinderella story the entire time, her thoughts and organization was not always there. She kind of jumped around to different things. So like I said, she was talking about the man at one point, said big tall man, and then she said, oh no, the flipper, the flipper. So since I knew about the Cinderella story and I knew how it kind of went, I could pick up on those different things. But if you didn't know she was talking about the Cinderella story, you may have not understood of what she was trying to explain or talk about. So to go in a little depth, Gloria was diagnosed, like I said, with a stroke in 2006, and based off her speech pattern, it does align with Broca's aphasia. So her aneurysm, it was most likely occurred to be in the inferior frontal lobe, which is the Brodmann's area 44 and 45, also known as Broca's area. And because my patient had right arm and right hand limiting movement, this leads me to believe that the aneurysm occurred on the left hemisphere.
Thank you. Alrighty, well, my client is Patrick. Patrick is almost 81 years old, and he has severe Broca's aphasia that is coexisting with apraxia of speech, resulting from a stroke that occurred 12 years prior. Patrick's speech is very limited and apraxic in nature, and although he has very limited verbal expressive skills, he demonstrates adequate auditory comprehension and is able to communicate nonverbally through gestures, and I'll give examples of that later. But it would initially look like he has global aphasia just because his speech is so limited. It's hardly there at all. But he was tested with the Western Aphasia Battery, and he was well above the cutoff for global aphasia, so his receptive language is really good. Through the use of gestures and sounds, Patrick still has the ability to communicate, and pretty effectively. Despite his difficulty with speaking and forming words, as I said, he has really good receptive language. When he was asked to tell the clinician how to make a peanut butter and jelly sandwich, he did not use any words, but he communicated effectively by using gestures with his left hand, and he pantomimed the whole scenario of making a peanut butter and jelly sandwich. He was unable to use his right arm because of hemiparesis, which I will explain more later too as well. He displays a variety of facial expressions to convey the message that he's trying to communicate. He's very expressive with his face and almost animated in the way that he communicates. He voices sounds with varying intonation, and even though he struggles to produce words, he's able to produce sound that conveys meaning. So, you know, he's not forming actual words, but he can hum a tune or sing a little tune, and it makes sense. Patrick was only able to produce the words hello and yeah in the video samples that I was given. Whenever he was presented with the famous people protocol activity, he was given pictures of different famous people and asked to tell the clinician who they were, and so he said yeah, and then when he was presented with Marilyn Monroe, he said hello, because she is an icon for beauty and all those things, and so it was evident that he knew immediately who she was, what the pop culture things were that were attached to her. He relies heavily on gestures and intonation changes in his voice, and so you know, people who know him really well are able to tell exactly what he's saying, but what he's trying to convey, but that's not necessarily true for people who don't know him. So, for example, during the famous people protocol, when presented with a picture of Elvis, he sings a tune from an Elvis song. So, he's something like that, which, you know, immediately right off the bat, anybody who knows who that is knows what he's talking about. And then for the Marilyn Monroe, as I said, he saw it, he laughs, and he whistled as he gestured up, because he was trying to convey that she is known for her skirt flying up with the wind flying under it. And so that just shows that he has those really good receptive language skills and is still able to communicate, but is still just really lacking in his speech capabilities. In regards to social aspects, he's very attentive to his communication partner.
He maintains appropriate eye contact. He embraced being really silly when completing the famous people protocol, and isn't afraid to, have fun, and he follows instructions with ease. So he immediately knew what the clinician meant when she said, tell me how you make a peanut butter and jelly sandwich. He laughed a lot during the interactions, had really good intonation, prosody in his voice, even though he wasn't able to form words. And then for the neural basis of his condition, because he had a stroke 12 years ago, it's most likely that he had an ischemic stroke that interrupted blood flow to the frontal lobe of his brain. And the stroke could have affected the left middle cerebral artery, which is, as you guys know, one of the most important arteries supplying blood to the brain, causing damage to Broca's area. And as you guys know too, Broca's area interacts with the flow of sensory information from the temporal cortex, devises a plan for speaking, and passes that along to the motor cortex, which controls the movements of the mouth. So Patrick presents with Broca's aphasia with apraxia of speech due to the motor cortex being affected during the stroke. And it was also apparent, as I said earlier, that he had hemiparesis on one side, which is also common with patients who have Broca's aphasia, because some of the blood vessels affected in Broca's aphasia also deliver blood to areas of the brain that control movement on one side of the body. So he was fully unable to move that arm. And that's all.
Thank you.